Welcome to the Brushing Up on Mouth Care Education Series. In this series, we are focusing on personal daily mouth care for older adults. Many older adults experience a decline in physical and mental health as they age. This often leaves them dependent on others to assist them with their personal care needs. There are 5 learning modules in this series that relate to the various aspects of providing daily mouth care. This is Education Session 1, Oral Health Basics. In this video, we will review why oral health care is important, how it works hand in hand with overall health and well-being for the residents in long-term care, the dental disease process, gingivitis, periodontitis, and dental cavities, and the signs and symptoms related to these diseases, plus how you as a long-term care provider can help prevent oral disease with the residents in your care. We will introduce the residents' oral health care assessment and the residents' personal oral care cards, the toolkit, and at the end, we will review what your role is in long-term care residents' daily oral care. Please note that this educational video was developed for use in long-term care, and therefore the term resident is used throughout to describe the recipient of care. However, this information is also valuable to those providing care in other settings, such as home care and acute care. In these instances, please take the term resident to mean client, patient, loved one, or whatever term best describes the person you are caring for. Importance of oral health. Gingivitis is a mild infection of the gums, but if left without being disturbed, can develop into periodontal disease. Periodontal disease involves the destruction of the gums and the bones surrounding the teeth, which support the teeth in the jaws. Periodontal disease is also related to other diseases, such as diabetes and heart disease. Periodontal disease is the leading cause of tooth loss in adults. Why is oral health important? There's a link between oral health and overall or systemic health. There's an increased risk in developing heart disease or stroke if you have untreated periodontal disease, because there appears to be a connection between periodontal disease and hardening of the arteries. Concerns about diabetes and periodontal disease are twofold. On one hand, if periodontal disease goes untreated in people with diabetes, they may find it more difficult to control their blood sugars. On the other hand, people with diabetes who have difficulty controlling their blood sugars have a greater chance of developing periodontal disease. This is because with diabetes, the blood vessels thicken, which slows down the removal of harmful bacteria and plaque from the body. Older adults with poor oral hygiene may have a greater risk of developing pneumonia because the plaque and bacteria in the mouth can be inhaled from the lungs. The presence of bacteria in the lungs is what can lead to pneumonia. By brushing the resident's mouth once a day, you can reduce this risk by 40 to 58%. Oral health and overall health, hand in hand. The teeth are the beginning of the digestive system. The food enters the mouth and the saliva glands are activated. This saliva softens the food as the teeth grind and mash, which causes the food to break apart into smaller particles. The tongue then pushes the small particles to the back of the throat where it is swallowed. The fewer teeth the residents have, the less chewing they can do. The food is not ground up enough into small particles, and the digestive system has to work harder and may not digest all the particles. This creates poor nutrition. The residents may have digestive problems and loss of appetite, which will reduce their overall health. Dental disease. Do your patients have gingivitis? 16 million Canadians do, and they don't even know it. Healthy gums look pink and firm. A healthy mouth looks clean and fresh. Gingivitis is a gum infection and is caused by bacteria, which we know as plaque. It forms on the teeth and around the gums. It can also form on dentures. Plaque is a colorless, sticky film that accumulates around the gums. The bacteria forms a toxin that causes gum disease and bad breath in your mouth. The signs of gingivitis and periodontal disease are obvious if you watch for them. Look for red, swollen, or bleeding gums, bad breath, loose teeth, and partials or dentures that do not fit properly. There could also be pus or exudate that is present in the mouth. Periodontal disease creates bone loss and recession around the teeth. There's usually no pain with periodontal disease until it gets to the severe stages. It is a silent disease. On the left is a healthy mouth. The gums are pink and the mouth looks clean. On the right is a mouth full of plaque, calculus, and red swollen gums. It doesn't look clean or healthy. Dental caries or cavities. If there was no sugar, there would be no cavities or dental decay. The plaque and bacteria plus food creates an acidic environment. Your mouth goes from a basic or a neutral environment to an acidic environment each time you consume food that contains sugar or starch. Bacteria in the mouth break down sugar and starch to produce acid, which then softens tooth enamel. This acid attack lasts for 5 to 15 minutes each time you eat. Cavities develop when the enamel on your teeth is destroyed with repeated acid attacks. When residents suck on candies all day long, their mouth stays acidic for long periods of time, and this allows for cavities to form on the teeth. The consistency of the food is also important. Soft candy and starchy foods can stick to the surfaces of the teeth and stay there for long periods of time. Sucking on candy allows the sugar to reach all areas of the mouth, causing decay to occur between the teeth as well as the front and the back of the teeth. Having candies or sweets with a meal is better than having them between meals. Brushing helps to reduce tooth decay. Independent elderly consume over 5 times the recommended sugar intake per day. Hospitalized elderly consume almost 8 times the recommended sugar per day. Prevention. How can you help prevent gingivitis, periodontitis, and cavities with the long-term care residents? There are 5 simple steps. Brush and floss daily. Brush with a soft toothbrush. Place the bristles of the toothbrush at a 45-degree angle towards the gums and gently massage the gums and brush the teeth. This procedure helps to stimulate the gums and keep the teeth healthy. Flossing is important to clean between the teeth. There are floss alternatives if flossing is difficult for the resident. Some alternatives are floss handles, floss wands, and Proxa brushes. Limit the number of snacks and drinks high in sugar. Rinse with an antiseptic antimicrobial rinse. This helps to kill the bacteria. Do not use rinses with alcohol in them. Remember that the residents in most cases already have dry mouth, and alcohol will dry the mouth even more. Get a checkup with a dental professional at least once a year. Eat a healthy, balanced diet with a variety of foods from the 4 food groups. Remember, only 33% of Canadians floss, and even fewer use mouth rinses. Resident oral health assessment. Look, feel, tell. Residents who are able should be encouraged to check their own mouth for anything that looks different from the day before or the week before. As part of their oral care daily procedures, such as brushing their teeth, flossing, and cleaning their dentures. For those residents that cannot do their own oral care, we encourage the long-term care staff to do a daily oral care check for them. This only takes about 60 seconds. This assessment is recommended after the removal of any dentures and partials and prior to doing any oral care, because if there is any infection, you may want to take care not to spread it around the resident's mouth. If you notice an infection, get the resident to rinse with warm salt water. Look. Take 60 seconds and look for anything abnormal, white or red patches. Where should you look? On all sides of the tongue, on the top and underneath. Cancer has a high prevalence on the tongue. You should check the floor of the mouth, the cheeks, and the hard palate. This is the area closest to the inside of the top teeth. And the soft palate. This is the area near the throat. Also check the gums and the teeth. Feel. Feel for any lumps, bumps, sores that do not heal, or that bleed. And check if the resident has trouble chewing or swallowing. Tell. What do you do if you find something abnormal or unusual? Write on the resident's oral health assessment sheet. Write your name, the resident's name, the date, and on the diagram, label the area of concern using the key provided. Then let the long-term care coordinator or the RN on duty know that you have found something abnormal. The rule of thumb is, if it is still there in 7 to 14 days, or if it continues to get worse, make arrangements for the resident to see a dentist or a doctor. Anyone who smokes, chews tobacco, or consumes alcohol is at higher risk of developing oral cancer. There are 3,400 new oral cancer cases detected each year in Canada, and 1,500 deaths due to oral cancer. Personal mouth care cards. Personal care cards are placed in the residents' washrooms along with oral care kits. Each resident will be given a care card that pertains to their personal mouth care. The different types of cards are natural teeth, a pink card; natural teeth and partial dentures, a purple card; natural teeth and dentures, upper or lower, a blue card; unable to swallow, a red card; no natural teeth and full dentures, a yellow card; no teeth and no dentures, a green card. These care cards are provided for you as long-term care workers and for the residents' families to use as a guideline for developing a daily oral care routine with the residents. Remember to get the residents involved in their own oral care as much as possible. Toolkits. Residents should keep all of their oral care supplies in their oral health toolkits. These kits consist of a metal basket with a plastic cup. The cup will allow residents to stand their toothbrush upright to dry. The cup and all other oral care supplies should be labeled with the resident's name or initials. Only oral care supplies should be stored in the toolkit. The resident's oral care card can stand in the back of the basket or can be hung on the wall of the washroom. Placing the oral care cards in a plastic baggie may help to prevent smudging. Your role. What is your role as a long-term care provider? Check the resident's mouth. Look, feel, tell, and record findings. Brush or encourage the resident to brush at least once a day. Check dentures and partials for any broken or damaged areas. Check the toolkit to make sure everything is present in the kit. And this should take about 3 to 5 minutes. Conclusion. Remember, oral health plays an important role in overall health. Proper oral care, including regular brushing and limiting sugar intake, will help prevent gingivitis, periodontitis, and dental caries. Good oral health will improve a resident's ability to chew their food, which will aid in healthy digestion and proper nutrition. Monitoring residents' oral health on a daily basis is an important part in providing daily oral care. Treating oral health issues in a timely manner will decrease their severity and ultimately their impact on the resident's overall health and well-being.
Let's test your knowledge. Which of the following are a sign of gingivitis? A. Red and swollen gums. B. Gums that bleed with brushing or flossing. C. Bad breath. Or D. All of the above. The answer is D. Any of the above could be a sign of gingivitis. Which of the following statements is not true about periodontal disease? A. It is completely reversible with good oral hygiene. B. There is usually no pain until later stages. C. It is the leading cause of tooth loss in adults. Or D. It starts off as gingivitis. The answer is A. It is not reversible. While gingivitis can be reversed with good oral hygiene, once the infection leads to bone loss, or periodontal disease, this bone loss can never be regained. Cavities, or dental caries, can be caused by eating or drinking A. Starchy foods such as crackers, B. Sweetened coffee or tea, C. Soft drinks, or D. All of the above. The answer is D. All of the above. Food and beverages containing sugar or starch are broken down by bacteria in the mouth to form an acid byproduct. When exposed to an acidic environment, the mineral in tooth enamel dissolves, leading to a cavity. Research has shown links between oral disease and A. Heart disease, B. Diabetes, C. Pneumonia, or D. All of the above. The answer is D. All of the above have had links to oral disease.